Hey everyone, did you know that 30 to 50% of the men have premature ejaculation and 25% of the women they don't have orgasm? We are going to answer how we can fix this problem in this presentation. Hey everyone, I remember one of my favorite and knowledgeable psychologists mentioned many times that there are two factors that keep the relationship strong and continue and connect those couple. Those are sex and kids. Even out in some situation without kid, but with the good connection and healthy sex life, still the people can have strong and persistent relationship. Among the most common cause of the failure in the relationship and breakup in long term is sexual problem that we know 30 to 50% of the men have premature ejaculation and 25% of the women they have anorgasmia or lack of the orgasm they don't experience in their life. 25% is not low, and unfortunately most of them are fixable. Before I go to start this topic, I would like to clear some misinformation that I noticed. One of them is that many people they think only men have orgasm. That is wrong or misconception. They think orgasm is when you have ejaculate something. That is not right. Women they have orgasm too and should have orgasm too. And actually women have some advantage. They can have multiple orgasm opposite of the men that there is a gap between 50 to 30 minutes for next run. So that is the advantage of the women, and the women need and should have orgasm. The second one is some people they think sex is more important and essential roles in the men compared to the women. That is completely wrong. If not higher, at least at the same level, sex is important for women too, and especially in psychological aspect that later we talk about that in another video and clip. Now let's go and talk about our topic. First, let's see how does orgasm happen. Orgasm is a Greek name word that meaning excitement and swelling, and sometimes we use climax and in slang we use it come. Orgasm is a suddenly discharge of electrical activity in some part of the brain that send message, fire up and send messages to many organs, including and especially to the pelvic organs in reproductive system, and cause rhythmic and involuntary muscular contraction in that region and those organs, and come with the highest feeling pleasure at that moment. Now let's see how what the stage we get to that the orgasm. For those physiologic changes that happen during sexual activity, we can classify and categorize the sexual cycle to four stages: excitement, plateau, orgasm, and resolution. In the excitement, after sexual stimulating and those other factor that I'm going to mention shortly, we get to the arousal stage, and our body, most of our body, increased the blood perfusion, especially in those critical organ that play a role in the sex activity, including those reproductive system and other sensitive and sexual part, including breast, genital area, face, eye, and all those. And heart rate start going up, blood pressure too. In the female, we can see lubrication in the vagina, swelling and engorgement of the clitoris, and even nipple for those men and women. And maybe we can see redness of the skin, flush, we get flush at this stage, maybe at the orgasm or plateau, depending of the body. The next step or stage is plateau. At this level, those changes, physiologic changes in our body, will be at the maximum level and doesn't increase, but those changes in the brain is still going up. Those changes, especially the level activity of some part of the brain, increase little by little. Some neurotransmitter increase. Finally, at one specific moment, that those accumulative sexual stimulation get to that specific point that for each person is a little different. Suddenly, it fire up those brain centers, and they send the message uh, to the all body, and that create orgasm, that including those rhythmic contraction and feeling uh, highest pleasure. At that moment, heart rate and blood pressure goes very high. Sometimes heart rate go over 100, blood pressure go over 200. And the in the men, it come with the ejaculation. And in women, beside of those muscular contraction in the, especially in the pelvic region, with or without in the limbs, legs and arm, and that pleasure uh, they will be feel too. Here, that the level of the orgasm we have different between the women and men. Men after orgasm, they go right away to the resolution stage. That it take about 15 to 30 minutes, little by little, blood pressure, all those changes drop to the baseline, the before sex. And for 15 to 30 minutes, men cannot have any erection anymore. Even if we have enough and good stimulation, the men cannot have this erection unless they use some medication that later we talk about that. Female is different. Women can have multiple orgasm if we have enough stimulation and correct stimulation, and the mindset of the person has been worked that way. Later I talk about what this does mean mindset. And in that case, women can have many times without any resolution after each other, sometimes even uh, 10 times, 20 times, and even more. It has been reported some people they can have 50 times orgasm as long as there is stimulation. There is another differences between the women and men for orgasm. Orgasm on men is only happen after stimulating of the genital area. Without penis, men cannot have orgasm without stimulating of the penis. But women can have orgasm different way. That is completely different. Most of the women, they come and have orgasm with intercourse direct. 50% are like that. They have to feel inside of their vagina. 25% those have orgasm. They feel orgasm after insemination, that releasing of the semen inside of the vagina and stimulating of the cervix and vagina and all those stuff. 25% only with stimulating the clitoris can have that experience. And some people, some women, they can have orgasm without even touching and stimulating genital area, just by touching other sensitive part like the breast, nipple, or other part sensitive part of the body. That each person is completely different. A human, especially on the women, is amazing and completely different. Some women can just without intercourse, with touching those other sensitive area, they can have orgasm, or even just with imagination, they can have orgasm. Some women, they can do that. They have this power and advantage that nature create on them. And after resolution, after orgasm, if the orgasm doesn't happen to the women, there will be a lot of changes in their brain. Later we talk about that. The orgasm is a button for reset in the brain. If we don't have orgasm, those reset doesn't work. And for functioning, normal function of the brain, once a while, is dependent of the person, we need that reset button will be activated, that is orgasm. Those women that they don't have orgasm, usually they have a lot of other psychology and physiology consequence that later we talk about that. Now let's go see a little more detail about the orgasm. Exactly what happened to our body when we have orgasm. What changes happen in our brain, hormonal, neurologic, and all those stuff. What changes we can see and what is the consequence of those changes. For a normal sex, we need many system function correctly. That included our sense, our nervous system, peripheral, and the brain. Let's go on see each of them how they play in sexual activity, normal sexual activity. First, our sense. All those five senses play some way in any stage of the sexual activity, including excitement up to the orgasm and resolution. The role of each of those senses among each person will be completely different, that dependent of their childhood development, how their sense has been developed, which one is sensitive or not, and their experiences. The role of each of those senses will be different for each person. Some people are visual, so those sexual scenes can stimulate more and become arousal with the watching. Some people with just hearing some word, sexual word. Some people with touching, and even among them specific spot or region of the body has more more role. For example, some people are touchy around their breast. Some people are more sensitive around their thigh. Each person is completely different. That depending how those senses developed and their experiences. But one thing I want to mention here, that among those senses, the smell play a very major role, especially bad smell has very strong effect on the all those stage of the sexual arousal. And most people, they forget put attention and take care of their body odor, and most of the time it turn off their partner if their smell is not good. So don't forget this part of our sexual activity. The next one is our nervous system, that all those stimulators, including all those sense, through the nerve, go through most of them from the especially genital area, goes through the nerve and through the spinal cord, here goes finally to the brain. And we know that we have two type of the peripheral nervous system. One of them is somatic, that responsible taking those stimulating sense go through the spine and go to the brain directly. Another are autonomic nervous system that include sympathetic and parasympathetic autonomic nervous system, that those sensual stimulator go through those uh, system, and they are not going through the spine, they are outside of the spine and go to the brain. For that reason, those people that the spinal cord has been damaged, but the lower part of the spinal cord, we call sacral region, this level, blue one, if is not damaged, still they can have erection and orgasm, and women orgasm too, even their spinal cord above that area has been damaged. Another part of very important part of the our sexual system is our state of the mind. That is, I call it state of mind, but the frontal cortex of the brain, or we call it frontal lobe. This part that responsible who we are, uh, our personality, how we think, how problem solving, and decision making, everything happened in the frontal lobe. This frontal lobe, in some way, some degree, has strong effect on other part of the brain, especially those the system of the emotion and memory and sexual arousal that is in the limbic system. This frontal cortex can affect those other part of the brain that may play major roles, those autonomic and finally orgasm in that person. uh, if I want to explain more simple, I can say how we think about the other people, especially the opposite gender. Well, how we think about the sex. Do we think is bad things just for a need? We have to do it or not? Our experience, past experience, everything can affect our function of the frontal cortex, and finally the function of limbic system and other part of the brain that's responsible for controlling non-volunteer response and finally orgasm in that person. That is the reason I brought this one, because one part of the treatment for uh, premature ejaculation and anorgasmia is fixing those problem in our frontal cortex, that is cognitive part. With cognitive behavior therapy we can fix that part. During sex, and especially orgasm, there are thousand changes in our body happens, and among them, the neuroendocrine and hormonal change are the most important aspect. That one of those are the hormone that's changed in the brain after orgasm. This fire up neurons, uh, release many hormone, or more accurate neurotransmitters in the brain and in circulation system, that among them these five neurotransmitters are more important, and we know a little more about them. Dopamine is responsible for that pleasure and enjoyment and gratification that we feel after orgasm. This neurotransmitter exactly secreted by the reward system in the brain, and exactly responsible for those behavior, addiction behavior, conditional behavior, and generally reward system. The another one is oxytocin, or sometimes we call it bonding hormone. In the women, responsible for that secretion of the milk and contraction of the genital, but in the during orgasm and sex, one of the major role for this neurotransmitter is attachment, create attachment, emotionally attachment between those two persons. The next one is endorphins. Endorphins are the internal morphines that body uh, produced, especially during sex and after climax. And they are responsible for many aspects of those feeling and changes in during sex, and one of them is increasing pain tolerance and relaxing. That is the reason people during sex, especially climax, they don't feel too much pain, even they behave aggressively because of other hormones, and they relax after orgasm. And for the same reason, many people become conditional for other changes, and when their stress goes high, their sex drive and willing for sex increase, and after sex they stress decrease. Another one is prolactin, that in non-pregnant after sex and climax, prolactin in the men has a refractory inhibitor effect on the sexual arousal. So on the men, it suppress sexual stimulation, so the men cannot have uh, erection for at least 15 to 30 minutes after orgasms. That is the one of the reason. Beside of that, it has been seen that prolactin has a regulatory effect on immune system. Another one is vasopressin, that we sometimes we called it antidiuretic hormone, in during related to the sex and brain. This hormone combined with the activity of oxytocin creates some supportive, aggressive, or more correct word, vigilance behavior toward the partner, and this is the function for gardening and supporting and protection of the partner and territory, that sometimes mislead people as a jealousy. That is not jealousy, that is the behavior for the obsession or obsessive behavior, that is almost a normal for protecting territory. In general, a good sex that most of the time end to the orgasm has a lot of effect on our body, including improving heart health, decreasing risk of the cancer, regulating and boosting immune system, reducing stress, and generally increasing longevity. And in the reality, we know that those people that they have good relationship and good sex life, they stay younger. Beside of the genetic, environment, diet, everything, one of the most important factor for staying young is having a good sex life and healthy sex life. Here, I would like to answer one question, that is this one: does the masturbation has the same effect as natural sex? This question come to for this the reason that some people they think is the masturbation come exactly you feel the same as the orgasm, and all those changes happen exactly as the natural sex. The problem with this, that people they think sex as a just only a physical activity. In fact, sex is a psychoneuroimmunology event, means both mind and body work together. Most people they forget that the one of the aspect of the sex and good sex is psychological part, that emotional part. And in this situation, masturbation, we don't have those emotional changes. Even though we can see most of those changes, especially those neurotransmitter, almost is the same except the testosterone. After masturbation, the level of the testosterone in the blood is different compared to the natural sex. But we will not have the other benefit of natural sex that we will have, including attachment and feeling. Those are not just these hormones, they are other circuit has been rewarded and encouraged or decreased in all part of the brain that come to this result. That is the reason uh, sex, natural sex is completely different from masturbation. We are done with the short review for the orgasm. And on the second part, I'm going to talk about the premature ejaculation, cause of it, and how we treat it. And the third part will be about anorgasmia. Up to the next time. Have a wonderful time.